This is a partial 3D reconstruction of a human embryo at Carnegie stage 11 in the mid part of the 4th week of gestation. The primitive ventricle is shown in red and the outflow in dark green. There is now a common atrial chamber, and we've shown the left half of this atrial chamber in white and the right half in gold. This is where the left and right atria will eventually develop. The endocardium is shown in deep red, and vascular channels are shown in orange. The developing foregut is in brown, and the dorsal pericardial wall, where second heart field cells are proliferating, is shown in chartreuse. We can see in this embryo that looping of the heart has progressed, and in fact now the dorsal mesocardium, which previously connected the entire heart tube with the prepharyngeal mesoderm, has largely disappeared. Here we can see in the mid part of the outflow and the primitive ventricle that there is no longer a connection with the dorsal pericardial wall. The only connections remain here at the outflow end between the outflow myocardium and the dorsal pericardial wall, here with second heart field cells, and at the venous inflow end, where the atria are developing, here between the prepharyngeal mesoderm and the atrial chambers as they're developing. This is the foregut, and we can see the anterior intestinal portal here and the very cranial edge of the omphalomesenteric sac that's beginning to develop here. Again, looping has progressed quite a bit. Now the primitive ventricle, instead of being cranial to the atrial chambers or inflow part of the heart, is now in front of or anterior to it, and it will continue to descend so that the atria will eventually be cranial to the developing ventricles. The primitive ventricle, shown here in red, just continues with the outflow chamber. If we look through the developing left side of the common atrium by making the walls transparent here, we can see the endocardial surface on the inside with some cardiac jelly remaining, and it's apparent that the venous inflows here and here communicate with both sides still of this common atrium. If we now make the right side transparent, we again see the venous inflow coming into the right side as well as to the left side of the common atrial chamber. We can continue to track the endocardial surface by making the myocardium of the primitive ventricle transparent. This is the AV canal portion, this constriction here on the endocardial surface, and it's apparent also that the AV canal connects only the left side of the common atrium with the primitive ventricle. There is no direct outflow from the right side of this atrium. Here, if we turn around and look from the right side, you can see that it ends blindly. The endocardial surface crosses over to the left before joining the AV canal and draining into the primitive ventricle. So this is still a very sequential heart. We can see that the primitive ventricular chamber has started to enlarge or balloon out from the outer curvature of the heart tube. And if we now make the outflow tract transparent, the myocardium of the outflow tract, we can again see the endocardium continuing smoothly as the outflow from the developing primitive ventricular chamber here. The primitive ventricle will become mostly the left ventricle, and the right ventricle will begin to balloon out from under the outflow tract here within another day or two. You can see that the outflow then continues with the aortic sac in the back, which divides into the two primitive arch arteries seen here. If we remove the pharynx from the back, we can see the dorsal pericardial wall here with the second heart field cells, and better see its connection with the atrium here caudally and with the outflow here cranially. It's here in the dorsal pericardial wall where second heart field cells are proliferating and adding to the heart tube. There's very little cell division going on within the heart tube itself. Instead, cells are reproducing in the dorsal pericardial wall and prepharyngeal mesoderm and then being added to the heart tube at both ends. So this is a stage 11 embryo, and at this stage we see progression of looping of the heart tube and beginning chamber development in the primitive ventricle. The atrium is still common, still has venous drainage symmetrical on both sides, and there are just the early arch arteries seen here arising from the aortic sac.